Hello world, this is Dr. Kundlas, and today we will be discussing about importance of annual physical and why everyone should have it. See, the basis for medicine is prevention. Once you go for your annual physical, you will be able to gain so much power and you will be a lot more ahead of treating anything. As wise people say, pound of prevention is better than any amount of trying to treat the disease and process. As we are talking in 2025, I found obligated that I should discuss with you guys what is annual physical is and how the disease process starts. We all start journey as fresh without any disease and a disability. As we're going through circle of life, we acquire bad habits, routines, whether voluntarily or through any kind of issue. These habits leads to chronic complications, chronic diseases, and a lot of pain and suffering. In annual physical, you go and see the doctor that you don't have a problem. You're going there to be evaluated so that you're taken care, that we could understand you as a human being, your habits, your workflows, your vices, which will lead to chronic complications in future. In this whole process, what we are trying to do is uncover the risk factors which will lead to problems in future. That is the basis for annual physical. And that is the reason most of the people don't get it. If you're in pain, you will go and see the doctor. Once you're going for annual physical, you have to be cognizant enough and understand that you are investing in your future self, that you have to be mature enough to understand all these things and take care of that part. When you go for physical, basically, we are preventing all the problems which you will be having in future. Also, if you, God forbid, have chronic medical problems, we will uncover any chronic medical problem you have developed at that time, and the treatment could be started. Most common killer in our society is heart attack and stroke. Unfortunately, high blood pressure, high cholesterol, and diabetes in initial stages do not have any kind of issues. We get all the chronic medical problems only when you have led to the complications. They all are silent. So as the cancer care, body can develop multiple cancers in the body. But in case of females, cervical cancer, breast cancer, and colon cancer, these three count towards the majority of the cancers they develop. In case of males, the prostate cancer is the other one which comes into play. So if you are properly screened for cervical cancer, breast cancer in case of female, colon cancer and lung cancer in both sexes, and prostate cancer in case of male, you will prevent. And again, 90% of the time in initial conditions, there is no sign and symptom. But if you will go and see your primary care in a properly fashion every year, then you will be able to get your preventive care, and these risk factors will be evaluated in a timely fashion, and you will get all the things taken care properly. Second thing which comes into play is how do we prepare for annual physical? Annual physical is no different than your regular visit. Only thing which you should expect is that you should have loose clothes, because most of the time physical examination involves a detailed examination. The clothes which could be taken off or could be manipulated properly so that you could have a thorough exam. On your attire, you should do that part. Like any other visit, you should bring your insurance card, your medications. And during this examination, when you go to your primary care office, you will have regular registration. Fortunately, most of the insurances pay for annual physical without any co-payments and any kind of upfront fees, because they are very smart. They want to have these annual physicals so that you can get proper testing done so that we could prevent the disease process. So after you go through the registration, your medical system will take you in the exam room and they will take your detailed vitals, including height, weight, blood pressure, respiratory rate, your oxygen saturation. Based on every office workflow, they will go through your general history. And what they're aiming at is to uncover the risk factors which will lead to disease process in the future. And then doctor will come in and you will have a detailed examination head to toe. All the systems will be checked. Your family history, past medical history, social history, your social habits, they will be evaluated. Once those things are taken care, after that, you will have a detailed plan based on your risk factors. The physician will discuss based on what they uncover during your examination history and the data which you provide. They will have a customized plan. They will talk to you. They will explain you what are the things which needs to be done. And usually you will have a blood test. And the blood test is aimed at looking for risk factors for chronic medical problems. Your CBC test, which pretty much will give you comprehensive profile on your blood, how much hemoglobin, white cell count, different kind of cells and ratios. Then is the chemistry profile, which is aimed at electrolytes, vitamins, minerals, kidney functions, liver test. Then your cholesterol test, looking at the total cholesterol, triglycerides, good cholesterol, bad cholesterol, to evaluate you for the risk. Your thyroid test will be done. Urine test will be done. And then based on what the physician uncovers, specialist test will be ordered. In case of seniors, we start screening for all vitamins and minerals to rule out any kind of reversible causes for dementia. Then for your bone health, your vitamin D will be tested, your calcium will be tested. And then coming to the cancer screening part of it is based on your risk profile and the age, we will have your pap smear will be updated, your mammogram will be scheduled, your colonoscopy if it has not done or altered methods will be taken care. Then if you are smoker, lung cancer and the prostate cancer in case screening with the PSA test in case of males will be done. So all these tests will be accomplished. Then we will evaluate your immunization status. This is a great time, like we have a lot of very effective immunization. I will not go into the politics of that and how individual people feel about the vaccines, but you will be given option for all the vaccines, including your flu, pneumonia, COVID, shingles, and RSV, and diphtheria and toxin, tetanus. All these things will be updated. After that, once you have gotten the blood work, all the screen tests been done, you will be set up for a follow-up visit in which you will be given the status of all these medical problems. And based on if they find a problem with your habits and all those things, you will have a customized plan, what to change and what things you could do that part. If they find some chronic medical problem, based on your discussion, your treatment plan will be initiated. Once your cancer screenings are accomplished, you will be given the schedule when to come back for a repeat next year and based on the guidelines. Immunization will be updated, and then if they've uncovered some chronic medical problem, you will be given option for the treatment. These are the nuances of which needs to be done. But the most beautiful part is if you are going for annual physical and the physician find chronic medical problem and they start treatment, you will never have the complications from that disease and you will never have any kind of chronic medical problem. And the same is in the kind of cancers. Once these cancers are picked up on routine screening, survival rate is almost 100%. Let's take in case of female, the most common cancer is the breast cancer. When physician finds any kind of a cancer based on a mammogram, there is a 99% prognosis rate of 5-year survival. But if you have a lump and you come to us when you find it, and the survival rate can drop to only 30%. So it is a very satisfying to find the things on annual physical. The same is true for any kind of cancer. Immunizations. If you have all the proper winter vaccines and you take all this vaccine, you prevent all those deadly diseases. In the United States, in winters, we lose about 50,000 seniors every year to these preventable diseases. Then, based on your functional status, your physical activity will be assessed and then you will be given a customized plan. In United States and rest of the world, if you develop following 5 habits, that will add on average 14 years of life, and that has been scientifically validated. Number one is your diet. If you eat primarily plant-based diet supplemented with quality meat and quality fats. Number two, exercise 30 minutes 5 times a week, preferably 7 days a week. Number three, sleep 7 to 9 hours. Number four, manage your mind and developing some kind of a meditation or de-stressing and defragmenting your brain. And number five is moderate amount of alcohol. In the studies, they found people who drink only one drink up to a day, whether it's a 1 glass of wine or 1 ounce, all these five things have been linked to longevity. But anything more than 1 ounce of wine or 30 ml of hard liquor or more than 1 glass of wine, they all lead to high blood pressure and counteract that part. And that is a very controversial topic. But in all these sanitarians where the people are living into 90s and 100, these were the 5 habits, and they were living on an average 14 years over and above most of the people are. I'm not recommending that people should start drinking to live long, but I'm just presenting you the data of this thing is. So I would say in a nutshell is that if you develop these 5 habits, go for yearly physicals. Fortunately, that is covered by most of the insurances free of cost. We will be able to evaluate your bad habits. We will be able to prevent chronic diseases and complications, and you will have a long, happy life. I hope I have added some value to this session. I will love to hear your comments and what are the other topics you would like us to prepare or present. Thank you very much. I will see you in next podcast.